Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 27, 2025. This video is on a paper released today, August 27th in JAMA, titled Partial Heart Transplant for Congenital Heart Disease from the Duke Cardiac Surgery Group. And there was an accompanying editorial titled Partial Heart Transplants, Growing Data for Growing Valves. Partial heart transplant addresses congenital valve disease by enabling valve growth. Standard homografts lack growth potential, necessitating repeated surgeries. This innovative approach preserves semilunar valve viability via targeted immunosuppression. Design retrospective case series at a single high-volume U.S. Pediatric center. 19 patients, median age 97 days, 53% male, April 2022 to December 2024. Valve types, 3 dual semilunar, 7 pulmonary, 2 aortic, and 7 aortic in pulmonary position. Immunosuppression, tacrolimus plus mycophenolate. Taper to monotherapy after 1 month. Follow-up median 26 weeks. Growth was assessed via Z-scores and Wilcoxon sign rank test. P-value less than 0.05. What were the results? All transplanted valves demonstrated growth and functioned well. Annular diameters, aortic 7 from 7 it increased to 14 millimeters. Pulmonary from 9 it increased to 17 millimeters, p-value 0.004. Leaflet length aortic from 0.5 to 1 millimeter and pulmonary increased from 0.49 to 0.675 millimeters, p-value 0.004. No valve-related reinterventions, minimal immunosuppression complications. Limitations of the study: small sample size, short follow-up, and limited DSA data. Long-term efficacy, immune dynamics, and broader applicability remain unknown. Key takeaway: partial heart transplant is feasible, safe, and enables somatic valve growth in infants. Offers promise for durable living valve replacement, especially in congenital heart disease. Broader use requires optimized immunosuppression and long-term surveillance. Prominent names in partial heart transplant: Ross procedure, Donald Nixon Ross, autografted the pulmonary valve to the aortic position. In this study, the living Ross was used. Damus K. Stansel procedure, Paul Damus, Michael K. and Horace Stansel. They pioneered the complex congenital surgical repair technique referenced in several patients. In this study, non-parametric statistical test was the Wilcoxon sign rank test used to confirm annular and leaflet growth. Wilson was a statistician named Frank Wilcoxon. What is the living Ross procedure? The traditional Ross procedure was by Donald N. Ross in 1967. Aortic valve replaced with the patient's own pulmonary valve. RVOT, right ventricular outflow tract, reconstructed with cryopreserved homograft. It was non-growing. The living Ross innovation: partial heart transplant provides a living pulmonary valve for RVOT reconstruction, promotes somatic growth, superior durability, and physiologic adaptation, especially promising for pediatric and young adult congenital valve disease. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.